Hi, my name is Maddie Keeley and I'm a former HOSA student. I'm studying pre-nursing at the University of Arizona and I'm currently working as a CNA. So today I'm going to show you how to transfer a patient with a specified disability from a bed to a wheelchair. So first I'm going to start by assembling the equipment that I'll need. I will wash my hands, and then I will greet my patient and introduce myself. I will then identify that I'm working with the correct patient, and I will explain to them that I'm going to move them from their bed to their wheelchair. I'm going to make sure my wheelchair is either placed at the head of bed with it facing the feet, or at the foot of the bed facing towards the head of the bed like I have it right now. Then I'm going to make sure the wheels are locked on the wheelchair so that it's in place. And then I'm going to lower the bed. And then I'm going to make sure the bed of the wheels are locked. And I'm also going to elevate the head of the patient. Right, and then I'm going to lower the side railings on the side the patient will be exiting the bed from. Then if they had a linen on top of them, I would pull it down so that they don't have it on them. And then I'm going to assist the patient to dangle their feet from the bed. So I will help them move. So their feet is dangling off the bed like so. And then I'm going to put a robe on the patient. Obviously they'd be able to sit up a little bit better, but with mannequins they don't quite work the way you want them to. And then I'd also make sure to put slippers on their feet. Then I'm going to position a gait belt around my patient's waist. I'll make sure the gait belt fits nice and snug, but not too tight. I'll tuck in that remaining end of the gait belt. Then I'm going to make sure I'm standing directly in front of the patient with about 12 inches apart between us. And then I'm going to make sure my leg is supporting theirs, making sure my knees are against the patient knees. I'm going to instruct the patient that they're going to assist by pushing against the bed with their hands in order to stand to a position. And they're going to do so on the count of 3 with me. And then I'm going to make sure I'm grabbing onto the gait belt when I lift the patient. And then I'm going to instruct the patient on the count of 3 to stand with me. 1, 2, 3. Then I will encourage them to take a few steps towards me, and then I will help them pivot towards the chair, and then set them down. Then I will make sure to adjust the footrests of the wheelchair so that they are comfortable. And I'm going to make sure to put a blanket on top of my resident, and I will ask them if they are comfortable. And I'm going to wash my hands after being with the patient, and I practice standard precautions throughout my skill and that I had proper communication with my patient.